Hi, I'm Alana.
And I'm Kate. And today we're going to talk about different myths surrounding healthcare in the United States for immigrants. And we're going to dispel those myths and talk about what is actually true.
So I've heard a lot of different things about healthcare in the United States, and I'm not sure what's a myth and what's true. And for instance, I'm not sure certain facts or myths about obtaining healthcare and prescription drugs. Today, Kate is going to dispel the myths. Kate, I've heard that I need a U.S. issued government ID in order to fill a prescription written by my doctor. Is that true?
That is not true, Alana. That is actually a myth. The only time you need an ID when you're filling a prescription is if you are getting a controlled substance. Controlled substances include narcotics such as hydrocodone and oxycodone. These are pain medications. And also drugs that are made with the ingredient pseudoephedrine, such as Sudafed or Allegra D, things that are decongestants. If you're filling a prescription for one of these drugs, the pharmacist will ask you for your ID. For pain medications, you can use any government-issued ID. It does not have to be an ID issued by the U.S. government. So you can use an ID from your home country. Mexico, Vietnam, India, wherever you're from, you can use that ID as long as it has a picture on it. Pharmacists need your picture ID when you're purchasing one of these drugs because they need to verify that you are who you say you are. If your ID does not have an address on it, the pharmacist will ask you for your address. If you want to keep your address confidential, you can give them the International Women's House P.O. Box address or a relative or friend's address. So you can keep your address confidential. The pharmacist will not report any of your information to any immigration authority. That is not why they need to see your ID. Now, if you are getting one of the drugs with pseudoephedrine, the decongestants, some pharmacies will require that you have a U.S. issued ID. But all you have to do is ask your pharmacy what kind of ID they need to see.
Thanks, Kate. That was really helpful. Kate, what about immigration paperwork? I've heard that I may have to show some immigration paperwork if I need to visit a doctor or pick up any medications.
This is also not true, Alana. Pharmacists will never ask you for any immigration documents. Remember, if a pharmacist asks you for your ID because you're purchasing one of the controlled drugs we talked about earlier, the pharmacist is only going to look at your picture. The pharmacist does not care whether you are or are not legally in the United States.
Okay. I'm also afraid that I may not be able to fill a prescription that the doctor wrote for me because I don't have health insurance.
This is also a myth. First of all, you do not need to have insurance to purchase a prescription in the U.S. You can pay by cash or credit card, whichever you prefer. In the United States, we have something called a discount pharmacy. Examples of discount pharmacies are Kroger, Publix, and Walmart. CVS is not a discount pharmacy. Medicines at discount pharmacies cost less than at regular pharmacies. Discount pharmacies also have lists of generic drugs that only cost about $10 each. This list includes antibiotics and also medications that are commonly prescribed for psychiatric problems, diabetes, high blood pressure, all kinds of physical ailments you could have. Now, Kroger, one of the discount pharmacies, will match competitors' drug prices. This means that if another pharmacy charges a lower price than Kroger for a particular drug, you can tell the Kroger pharmacist about the different price, and the Kroger pharmacist will charge you that price, the competitor's price.
Great. So how do I find out if a pharmacy is charging a lower price than Kroger?
Well, all you have to do is call that pharmacy and ask them how much they charge for your drug. You will need to know how much of the medication your doctor prescribed you and the dosage. That way, the other pharmacy will be able to give you an accurate price for your drug. Costco is an example of a pharmacy that sometimes has drugs less expensive than those at Kroger.
That sounds great. What can other discount pharmacies offer me?
Well, that's a really good question. So Walmart and Sam's Club have lists of $4 generic prescriptions. Publix has a list of free antibiotics. Publix also offers free lisinopril, which is used to manage high blood pressure, and also metformin, which is used to manage diabetes in adults.
Wow, that sounds great. Let me just make sure I understand what you're saying about the Kroger price matching program. Since Kroger will match the price of any competitor, I could fill a prescription for an antibiotic at Kroger and then let the pharmacist know the antibiotic is free at Publix, and then I'll be able to receive the antibiotic free at Kroger?
That's exactly right.
Great. One more thing. I know that brand name medications are more expensive than generic medications. If your doctor prescribes you any medication, you should ask him or her whether they prescribed you a brand name or a generic medication?
Yes.
Okay. And for most brand name medications, there are comparable generic versions.
Exactly.
Okay. So I should ask my doctor to prescribe generic versions of the medication so that it will be less expensive?
Yes, exactly. And your doctor will know which generic version is the least expensive, because sometimes one brand name medication will have several generic options.
Okay, that's great. That sounds great. Okay, I've also heard that if I don't have an ID issued by the U.S. government, or if I'm not a United States citizen, I won't be able to get health care. Is that true?
That is not true, Alana. That is definitely a myth. There are some medical clinics that do require a valid picture ID or proof of residency in order to provide you with health care services. But there are also medical clinics that may ask you for an ID, but even if you don't have one, they'll still give you medical services. If a medical clinic does need a document to verify your proof of residency or where you live, that you have some sort of permanent home here, you have several options. If you do have a permanent home, you can bring in a utility bill or some other kind of bill that has your name on it, or you can bring in a notarized letter from your landlord. If you're staying at the IWH shelter, you can get a letter from one of the staff members that says that you're staying there and it has, the IWH P.O. box address, so your address will still remain confidential. Some clinics that may ask you for an ID, but will provide you with services even if you don't have an ID, are the Grant Park Clinic, the Healing Community Center, and St. Joseph's Mercy Care Services. Now, an example of a clinic that may need to see an ID in order to give you services is the Good Samaritan Health Center.
So, if I don't have an ID, I will still be able to receive services at the Grant Park Clinic, the Healing Community Center, and St. Joseph's Mercy Care Services?
Yes.
Kate, what if I go to a medical clinic and the nurse or doctor asks me for my ID? And if I don't have an ID and I tell them that, will they report me to the authorities?
Sometimes it may be scary if you go to the doctor or a medical clinic and someone asks you for an ID. But you should know that these medical clinics were started to help you and to help clients like you. And these clinics do not report any immigration status to the authorities. That's not what they're there for.
I've also heard that if I don't have insurance, I won't be able to afford to go to the doctor.
Again, this is a myth. Fortunately, there are healthcare services in America that are available for uninsured and low-income people. And each clinic is unique. Each clinic offers different services and has different eligibility requirements for clients. And we kind of talked about those a little earlier. But all clinics have the same focus of providing care to those who need it and treating each person with dignity and respect, regardless of income, ethnicity, religion, or legal status.
And how much will a clinic cost?
Well, there are medical clinics that offer free services, and there are medical clinics that offer low-cost services. And frequently, low-cost services are referred to as services provided on a sliding scale or with a sliding scale fee. When services are offered with a sliding scale fee, you will be charged for the services based on your employment status and your income. So that means if you are not employed, you will either be charged nothing or a very, very low fee. One of the benefits of having a sliding scale fee is that people who make less money can get the same quality care as people who make more money. If you are legally employed, you will need to bring a copy of your three most recent pay stubs, or you could bring a copy of your W-2 or your tax return. If you're unemployed or you're currently staying at the International Women's House shelter, you can bring a letter from the shelter staff or the unemployment office and show that to the staff at the medical clinic.
What are some clinics that I can go to that offer free or reduced cost services?
That's a good question. So clinics that offer reduced cost services on a sliding scale fee are the Good Samaritan Health Center, the Grant Park Clinic, the Healing Community Center, and St. Joseph's Mercy Care Services. Some of these clinics also offer free services. The clinics that offer the free services are the Grant Park Clinic, the Healing Community Center, and St. Joseph's Mercy Care Services.
Kate, if I go to a free clinic, will I be able to receive high-quality services? What if I need different kinds of services, like a gynecological exam or a dental checkup?
Luckily, Alana, there are many quality services offered by the clinics that serve people who don't have insurance. The people who provide these services, the doctors and the nurses, are competent and experienced healthcare professionals, and they are dedicated to serving populations that don't have easy access to medical services. The availability of services vary by the clinic, but most clinics at least offer primary care services such as general physicals or checkups, flu shots, things like that. Some clinics also offer dental services, health education, and social services. You can ask the International Women's House staff to help you find a clinic that has the services you need. The International Women's House staff actually has a resource guide, and all the clinics and their services are listed there.
That's great.
Did that answer all your questions today, Alana?
Yes, it did. Thank you, Kate.
You're welcome, and we hope that this video helps you finding the healthcare services that you need.